Hi there, this is Dr. Karen Brine from Brine Chiropractic, and welcome to our practice. And as part of your care here, we invite you to participate in some educational programs, and the first of which is our healthcare orientation. We find that patients that actually take the time to go through and learn this material do better as a patient. They get through their treatments quicker, and that's always good because they get through the phases of care quicker, but also we find that it helps them to understand um, more about their treatment, and in doing so, um, it helps them more with compliance. It also helps with your supporting cast of characters at home, your significant other, family members who also want to understand what you are going through as a patient and how they might be able to help you improve at a quicker rate and maintain um, health at the optimum level you hope to achieve. So this little presentation will take just a few minutes of your time, and sit back, and if you have any questions as you're going through this, write them down and feel free to ask us in the office on your next visit. The first thing I'd like to talk about is, you see this article here, Americans make up about 4% of the world's total population, and yet we expend about 50% of all the money spent on medical care, and one would think we would be pretty healthy. But according to the World Health Organization, the United States ranks about 37 in world health. Medical errors are the third most common cause of death in this country, and yet the United States is the most technologically advanced. Now, what's wrong with this picture? I ask that while you're at home, you think of this question. What is good health to you? What does it mean? When I give these talks in person, my audience, which is composed of mostly patients and their family and friends, and they respond with thoughts of, well, good health is lack of pain, being able to do some of the things that they like to do without their pain or injury or disability interfering with the ability to do those things. And so those are pretty good examples of what good health is. But I'd like to expand on that and give you the definitions of good health. Health, from Dorland's Medical Dictionary, is a state of optimum physical, mental, and social well-being, and not merely the absence of disease or infirmities. Also, Webster's Dictionary defines health as a condition of wholeness to which all of the organs are functioning 100% of the time. Now, chiropractic definition is a health profession that's concerned with the diagnosis, the treatment, and prevention of disorders of the neuromusculoskeletal system and the effects these disorders have on the nervous system and total health. Chiropractic allows the patient to regain their health naturally. Now, chiropractic treatment includes diagnosis of spinal stresses that lead to illness, hands-on manipulation of the joints of the spine, soft tissue or muscle therapy, home exercises, nutritional guidance, the use of therapies such as hot or cold packs. We also have electrical stimulation, ultrasound, cold laser therapy. Those are the typical treatments that you would find in a chiropractic office. Now, who can benefit from chiropractic care? Well, adults, children, athletes, the elderly, pretty much anyone. Why is that? Because we all have a spine and a nervous system. Now, some people ask me, hey doc, are you really a doctor? What is your education and how does it compare to, say, their primary care physician? My answer to this is absolutely. Chiropractors are doctors. We have an undergraduate degree. Usually our Bachelor of Science is in some kind of pre-med studies or biology or chemistry, and then go on to a 5-year chiropractic PhD level course, which is very similar to your primary care physician. If you notice in this chart, the subjects, anatomy, physiology, pathology, chemistry, bacteriology, and so forth. Chiropractors learn and study a significantly more percentage or more hours in orthopedics, x-ray, neurology, and the physiology and anatomy portions of the studies, where you will see your general practitioner might be focusing their studies more on pathology and the chemistry, um, and maybe more on the psychiatric or OB/GYN, because clearly that's not our area of expertise. So when we talk about who has the qualifications to diagnose and treat a musculoskeletal nervous system injury, clearly looking at this, you can see that a doctor of chiropractic has the necessary and in many cases more education than the average medical doctor in those particular areas. I like this quote. Thomas Edison: "The doctor of future will give no medicine but will interest his patients in the care of human frame, in diet, and in the cause and prevention of disease." Wellness depends on homeostasis. Now, homeostasis is the body's ability to maintain a state of balance or ease. Homeostasis is controlled and coordinated by the body's inner wisdom called innate intelligence. I like to throw this out here because stress is what causes most diseases. Stress of certain kinds, and we categorize stress in 3 groups, which we will get into in a little bit. But the nation spends about 25% of its total health care tab, or about $250 billion a year, on medical care for unhealthy habits and other modifiable health risks, such as smoking and obesity. Now, unless you've been living under a rock, you know that insurance companies now are rewarding their customers or clients with lower healthcare premiums for those individuals that are non-smokers, for those folks that keep their blood pressure lower, for those people who are exercising and maintaining good diets. And this is the reason, because all of those unhealthy habits down the line will create many more illnesses that are costly. And a good portion of it can be prevented. Now, good health depends on many factors. Genetics, that's one thing we can't really control, can we? Lifestyle, here's where we have the most influence, is on our lifestyle, what we choose to do on a day-to-day basis. Our occupation, our environment, where we live, and here's another one that's interesting, which is the past history of trauma or disease. And we'll see later how this can affect our level of good health. Again, on genetics, we can have a genetic predisposition or weakness to a particular disease or a condition. And as you know, this is not anything that we can really control. We can't determine who our parents are and what genes they have donated, so to speak, to you, and as a result, what illnesses we develop because of those genetics. Lifestyle, the one that we said that we have the most control over. This is what we're talking about. There's 6 facets to our lifestyle. Nutrition, the use of prescription and non-prescription drugs, including alcohol and nicotine. Those are those bad habits that we talked about. And just adhering to a well-balanced diet that supports healthy nutrition can play a huge role in our lifestyle. Exercise and physical fitness, that's key. Now, proper ergonomics. The term ergonomics is a fancy name for describing how we should sit, how should we lift, how should we do the things that we do in our work environment or in our hobbies or activities, exercise, that can either have a great impact in supporting our musculoskeletal complaints, or the reverse is true. If you're not adhering to proper ergonomics, it can have a huge negative impact on your spinal alignment and your musculoskeletal conditions. Sufficient rest, now that's key. Why is that important? Your body only heals itself when you're at a state of relaxation or rest. And cells in your body take 90 days to die off and replace itself with healthy tissue. And this activity takes place when your body is at rest and when you're sleeping. You get the maximum benefit out of healing properties when you are resting. 5 here, mental attitude and adaptability to stress. This is key, and we're hearing more and more about this every day, about how stressful our lifestyles are. Now, the one thing that's important is that our body does not identify whether the stress that we're undergoing is a positive or a happy stress or an exciting stress, like a challenging job or exciting things that are occurring in someone's life, like they're planning for a wedding or planning for the birth of a child. Those they carry with it a certain amount of stress, but it's also an exciting, fun stress. The reverse is true where you have the negative stresses, a loss of a job, a death of a family member, marital problems, problems within your home. That is also a mental stress and physical stress that comes about because of bad things that are happening. But again, the body does not differentiate between a good stress or exciting stress and the negative stress. Your body's still going to respond as though it's being stressed out or taxed. The last thing here, a balanced nervous system. Here's where chiropractic comes into play. We're going to find out in this talk why having a balanced nervous system is extremely important. And here is where the only profession that deals with balancing our nervous system is chiropractic, and you need to understand that. Now, talking about illness or injury, when your daily stress outweighs your body's ability to adapt to this stress because of a breakdown in one or more of the 6 facets of health that we just talked about, that's when we become sick or have an injury. So let me reiterate that. If you are adhering to the 6 facets of good health and stress bombards you, most cases you're able to adapt to that stress because you're supporting yourself in the right ways. If, however, you're bombarded with the stress and that stress outweighs all the things that you're doing to change your lifestyle or support your lifestyle, that's when you need a little assistance. For more than a decade, people have taken aspirin every day in the misguided belief that they were safeguarding their cardiac health. Well, better health through better chemistry has failed. So there's got to be a better answer. And we also know that a well-known link between depression and fatal heart attacks may be mostly a result of lack of exercise. So here we're hitting in on some of the facts of the lifestyle to be concerned about. Occupation, how you sit all day, lift all day, or deal with stress all day plays an important role. Here's the ergonomics. And again, past history of trauma, rest, and proper healing. Every time you have an injury or pain, there is healing that is occurring with the formation of scar tissue. This is what takes the 90 days for your healthy tissue to kind of break down, be brought away in the bloodstream, and have the good nutrients come in and build better tissue. Now, through serious injury, repetitive movements, or aging, you can lose the health of the tissues, which may be irreversible. And to help ensure um, proper building blocks of healthy tissue, you've got to get the proper rest that we talked about. This slide is making mention of our environment and our ability to adapt to an environment that we can't necessarily change readily, but we can make certain changes or certain choices based on the environment that we live. So take a look around. What is the quality of the water that you drink, the foods you eat, and the air that you breathe? And making smart choices can make a big difference, ultimately with your outcome of how healthy you eventually are. Now we're going to talk about the curves of the spine and how they play a huge role in ergonomics and your biomechanics. Now, I'm asked often, what's the best way to sleep? Follow the cursor on here, and I'm going to show you in this area here. This is showing what happens to the spine when you sleep on your stomach. I'm going to preface that by saying, after I explain this to you, I don't support sleeping on your stomach at all. Reason being is, in order to breathe, you have to turn your head one direction or the other. And the cervical spine is much like a childproof pill bottle in that you have to compress it in order to turn. And that's exactly what's happening. The amount of hours that you're sleeping every night is you're causing a compression to the joints of the cervical spine. So I advocate really sleeping on your side, like as in this position here, or sleeping on your back here. But it's important that you take a measurement from the shoulder to the neck, and that'll give you the distance that the height should be of your pillow. And the reason that that's important is if the pillow is too low or reversely is too high, this the spine will not be straight. It'll be curved either left or right. Now, same thing when you sleep on your back. You should have a nice, gentle, sloping curve that supports the cervical curve in the spine. Too low, it causes a flattening of the spine or compression, and too high, it causes your head to be flexed in a forward position, which actually puts some pressure on the facet joints of the cervical spine. Now over in here, this is showing how there are available cervical pillows, they're therapeutic pillows, that will enable you to be able to fluently move from laying on your back to either side without actually waking up in the middle of the night and turning the pillow. This is important because, as we said, you have to measure these distances from your shoulder to your head when you're on your side and the distance that supports the curve when you're on your back. And so a pre-measured pillow specifically for you is ideal, and we can help you locate those. This picture down here is how a patient should be sleeping with a pillow between their knees to support the curve of the lumbar spine. Now, without a pillow here, what happens is the knee tips down and increases what's called our Q angle or quadriceps angle. In women, we already have an increased angle, more so than men. So by not putting a pillow here, we're further exaggerating that Q angle, which ultimately can cause some pain in the hips. When you're sleeping on your back, it's good support for your low back by just putting a pillow underneath your knees because that helps maintain the lumbar curve. Now let's talk about these curves. They're designed like shocks in a car for shock absorption. And what do we need shocks for? If a load or a force is taken in by the car, what happens is the shocks help adapt to that force that is imposed on the car. Same thing with the spine. By putting in the curves, the cervical, the thoracic, the lumbar curve, by putting these curves in, you are help facilitating the shock absorption of the spine just by the fact that you've created these curves, and it kind of takes away some of the stress. If you remove these curves of the spine, you are no longer able to withstand certain shocks or certain load forces on the spine, and that in turn will set you up for further trauma to that particular area down the line. So keep that in mind. Now, how are these curves developed? We have a child in utero, and that's a C-shaped curve. When the child is able to hold their head up and start to crawl, that first curve or cervical curve develops. From here to here, we have a thoracic curve developing, and the child has enough strength to push up on the muscles of the upper back and start to crawl. From this position to this position, the lumbar curve develops, and that helps support the muscles of the low back and the legs so they can stand and start to walk. It's not a good idea at all to give these children those jolly jumpers or those walkers that help force them to stand on the spine prior to the development of those curves. Now, some curves that you don't want to see develop are the side-to-side lateral curves, such as in the scoliosis. Now, when you look at somebody from the back and you see that their spine is not completely straight, what you also can see is whether a shoulder is higher than the other, a hip is higher than the other, perhaps the knees, there's a discrepancy, perhaps the shoulder or the shoulder blade is protruding out, or the hip is kind of swayed back from one side to the other. Those are all examples of scoliosis and different progressions of scoliosis. What you might not know is that there are two types of scoliosis. The first one is an acquired scoliosis, which is something that you develop secondary to some other condition, whether it be a spinal subluxation, whether it's a short leg because of a trauma, a sports injury, or muscle imbalance that contributes to the acquired scoliosis. Those are scoliosis types that can be easily corrected and reduced with chiropractic care. The other type of scoliosis, which is a congenital type or an idiopathic, is the one that you see most often in adolescent females as they go through their growth spurt. These curvatures we cannot completely get rid of, whether you have physical therapy, have orthopedic surgery intervention. Those you cannot completely do away with it because it is a genetic type of curve. But early detection or identifying that you have a congenital scoliosis is important because we can reduce the amount of the curve or the progression of that curve by incorporating different types of techniques or treatments. And that's the important part about having children evaluated, because this type of scoliosis, again, is seen more frequently in adolescent females, and it tends to accelerate during that time of growth when so many things are changing in that particular adolescent. Also interesting to note that if a parent has an idiopathic scoliosis, their children are susceptible to developing it, obviously because of genetics, but 25% of the children most likely will have scoliosis. So really important to get your children in, to have them evaluated. A good time to start evaluating for idiopathic scoliosis is anywhere between 6 and 8 years old, and then to follow the progression as they go through adolescence. Now what I'd like to talk about is um, the curves of the lumbar spine. Now this is important. We've talked about how they develop, but what do we do to help protect the curves of the lumbar spine? One of the things that we look at is how do we lift, and job injuries are one of the most prevalent with back injuries because people are lifting improperly. So let's take a look at this. The picture on the top here is showing the correct way to lift by maintaining the curve of the lumbar spine. Now let's look at the colors. The blue is the discs, the yellow is the spinal cord and the nerves that exit out. So when all possible, try and lift while maintaining this curve in the lumbar spine. And to do that, in this position, the curve is maintained, the upper back is straight, you're bending your knees, and the center of gravity is down through the largest part of the body, or the biggest muscle on the body actually is the quadriceps. And so in doing this, you are using the force of the quadriceps and the core muscles to lift, rather than the picture in the bottom where the center of gravity here is off to the front. When you have this situation, whether you're bending your knees or not, and you lift, what happens is there's a vector force pulling on the curves of the disc and creating this stress and overuse, wear and tear of the facet joints of the lumbar spine. Now we talk about sciatica. Everybody wants to know, what is sciatica? My doctor told me I have sciatica. Well, sciatica is a general term that's labeled to somebody that has back pain with leg pain. There are so many different ways to develop a sciatic nerve pain, but it's like a generalized irritation of this nerve. Now, the sciatic nerve is composed of multiple levels of the lumbar spine nerves that come together through the obturator foramen here and form one thick nerve called the sciatic nerve. Then this nerve goes down the leg and divides into many different branches. So by saying somebody has a sciatica, they can have a sciatica because of a herniated disc, they can have sciatica because of a sacroiliac problem, they can have sciatica because of a muscle spasm in the low back that's contributing to irritation to the nerve. You can also see here from the picture on the right that ligaments can be damaged from lifting improperly. We already talked about the appropriate way to lift, but if you do it improperly over time, you develop micro trauma or micro tears to the ligament structures of the spine over in here, and that sets you up for further injuries, muscle strains, muscle sprains, and effects on the sciatic nerve. We're going to see on this next picture a more extensive view of the ligaments of the lumbar spine, as well as the ligaments of the sacroiliac joint. And a lot of times people will develop a sacroiliac problem that affects their sciatic nerve. If you look here on this image, here is the sacrum, the iliac crest, and you can see that there are muscles that attach from the iliac crest to your hips, the true hip. A lot of times people think their sacroiliac joint is their hip, where the hip is truly where the femoral head of the leg inserts on the pelvis here. Now, with ligament damage and effects to the muscles, you can have an issue with the piriformis muscle. Piriformis muscle attaches from the sacroiliac edge or the sacral edge, attaching out onto the hip. And sometimes this muscle can become spasmed because of a mechanical problem within the sacroiliac joint. Now, the sciatic nerve usually runs underneath the piriformis muscle, but anatomically, some individuals, the sciatic nerve runs through the muscle. Other people, it runs over the muscle. But regardless of where it runs, any effect of the piriformis muscle can in turn create inflammation or irritation of the sciatic nerve. So this just points out how a problem with the sacroiliac joint can be one of the reasons why you can have a sciatic nerve problem. Another reason could be a problem with the disc. Now let's look at the disc. The disc is hockey puck. Actually, it looks like a golf ball, but functions more like a hockey puck. Now let's take the outer layer of the golf ball off, and what you see is interlocking fibers or interlocking rubber bands, and those represent the ligaments or the interlocking ligaments of the disc. Now if we take one of these ligaments and individually identify it here, this is a healthy ligament. A person that has an acute injury, an acute abrupt traumatic injury, their ligament, most of it will remain intact. Portion of it will be disrupted and have a huge disruption with a lot of inflammation, a lot of bleeding, and that's what we call a macro trauma or an acute injury to the ligament. Over here on this side is depicting a ligament that has had a series of repeated micro tears or trauma to the ligament over time. You'll notice that that ligament is very loose, very similarly to a rubber band. If you take a rubber band and stretch it and twist it and pull on it, what happens is it becomes very weak and very loose. And that's exactly what's happening to the ligaments of a joint. Any joint, really, but we're focusing right now on the spine. So you have this ligament that's loose, weak, and micro tears in it here. So this would be the individual that goes out on the weekend and does a lot of work around their home. They have a micro tear to the ligaments and inflammation and pain. After a period of days to a week or two, the inflammation kind of goes down and the patient will feel better somewhat until the next time they go and they overextend themselves. And this is where we see a cycle setting up where a person does something, they have pain, they rest it, it feels better until the next time comes around. You will be developing a lot of scar tissue in that ligament structure of the disc and a lot of weakness to the area. Now what we're going to do is demonstrate that hockey puck shape that I was talking about earlier. If we look at this, this is the vertebral body. Here's where the spinal cord comes through, and this hole is the intervertebral foramen where the nerves exit out each spinal level. The disc, what we're going to do is take a cross-section view of the disc and look down and into the disc. And here's where we're looking at this hockey puck shape. The outer portion of the disc is called the annulus fibrosus. The inner portion is called the nucleus pulposus. And here's the center part of the spinal cord where the nerves exit at each vertebral level. Regardless of whether you're in the low back, the mid back, or the cervical spine, that's pretty much what you're going to see when you take a cross-section view of the disc. Now let's talk about that ligament structure. Whether you have an acute abrupt tear of the ligament or you have a micro tear that occurs repeatedly over time, you're still creating weakness to the ligament structures of the disc. Now the weakness might be in the front part of the body, as it's shown in this picture, or it might be in the back part of the body. And the back is depicted by, you see these bumps here? These are the spinous processes, or the bumps you feel down the spine. So when you have the ligament structure towards the back of the body that's damaged, it will create a different type of pain syndrome. Now, one of the basic laws of physics is that matter will move towards the area of least resistance. We have weakness of the ligaments. It's not going to support as well as this part of the disc. So anything that is exerting pressure on this wall, if you will, of ligament, it's going to be weaker here. So matter will move towards the area of least resistance. So this is what we call a slipped disc or a protruding disc, or even a bulge disc, is where the center portion, the nucleus pulposus, part of the disc will gravitate towards that area of give or weakness. Now, a person who has this area in the front part of the body will have localized spinal pain. This person who has the weakness in the back part or the posterior part of the spine will not only have localized back pain, but will also have pain where this nerve travels to. So if you're in the neck, you will have neck pain and arm pain because the nerve most likely will travel down to the arm. If it's in the low back, that nerve will travel down to the legs in addition to local spinal pain. And that's what we call a protruding or bulged disc. Now, a herniated disc would be if this blue material breaks completely through the wall of ligament and comes out to the other side. If it's in the back, it will come out through a complete break or give in this ligament structure, and it will put direct pressure on the nerve that travels down to the periphery. That's what we call a herniated disc. Now, a herniated disc with fragmentation is when a piece of this blue chips off and it breaks through, and that blue is free floating around the nerve. Now, all of these instances, because it's a direct reflection on what is happening to the disc material, that can be treated with a conservative approach through chiropractic care, physical therapy, exercise. Many different components play a role in the rehabilitation from a conservative standpoint of a herniated disc. Not everybody that has a herniated disc is going to require surgery. In fact, the only people that are actually referred to a neurosurgeon are the ones that have unrelenting pain that is not letting up, are those individuals who have neurological deficits, which means there's a significant problem with the nerves that travel to the periphery, those folks that have bowel or bladder loss of control. So most of the people that would fall into a position where, when we talk about the unrelenting pain, say they're an athlete, a professional athlete that needs to get back on the field because that's their job. Those people might engage in a quick fix surgery. But with anything, it's not necessarily a quick fix. Surgery causes more scar tissue down the line, and that's why neurosurgeons are not quick to cut, particularly in a younger individual, because they do find that about 50% of those individuals will have long-term problems as a result of going in and operating on the herniated disc. So oftentimes a neurosurgeon will refer the patient back to our office and say continue with conservative therapy. Now we're going to talk about the disc a little bit more. The disc is fluid, or has fluid in the disc, so it has to have a way of having new fluid moved into the disc and the old stagnant fluid removed out. And it does so through exercise, because the blood supply is not as supported in an individual who's 25 years old or more, because it doesn't need the blood supply to those areas for development and growth. So the body kind of rearranges things and takes the blood supply to other areas for better usage. So we're relying more on exercise or maintaining a very um, mobile lifestyle to keep that fluid transport happening in the disc. So a person that interferes with that fluid transport in some way, shape, or form will have most likely degenerative disc disease because they don't have a way of having that fluid transport coming back in and out of the disc. So let's talk about that. Who would those people be that would have an impairment of the fluid transport? Well, it would be a person who leads a sedentary life, someone who has an arthritic condition that prevents them from exercising. It's catch-22. You don't use it, you lose it. So the more pain you have, the less likely you're going to be mobile and the more degenerative changes you might have. So that's why chiropractic is an excellent approach to somebody that has spinal degenerative changes, because where the patient might not feel like exercising, the chiropractic manipulation to restore normal motion to the joint takes over and kind of assists that patient until they're actually able to start feeling better and can engage in an exercise program. Another person who might have problems with fluid transport would be somebody who's a diabetic, who has problems with vascular issues to begin with, someone who's a smoker. Smokers cut their oxygen transport within the blood vessels and also by extension decreases that nutrient flow to the discs. So you have to watch it. If you're a smoker, you're most likely going to have degenerative disc disease than somebody else. Here's another picture of a herniated disc and what you're seeing in the spine. Here's the outer portion of the disc, the annulus fibrosus, and the nucleus pulposus here is shown in white. Now when you have that give or weakness in the wall of the ligament structure and you have the protrusion or herniation that goes through, this is what you actually see and how it affects the peripheral nerve. And you can tell certainly that this person who has this pressure on this nerve would have symptoms of where that nerve would be traveling. And when surgical intervention is administered, you go in and cut through the muscle tissue and remove this extruded disc. Conservatively, we would take this disc material and through exercise and through traction and techniques that we would do here, it helps absorb this disc material into the bloodstream to take it away, and then we give you exercises that actually support this. So how do we treat herniated discs conservatively? Well, you're going to look on here. Here's a picture of an MRI that shows damage to a lumbar spine disc. Here's the vertebral bodies. Here's the discs. Another vertebral body and another disc. Here's the spinal cord. And obviously, as you're looking down through the spinal cord, you can see how this right here looks different than above and below. That is the level of a herniated disc, and the disc material has protruded through the disc and has compromised or impinged what's called the thecal sac. So whenever you read your MRI report, there may make mention to whether there is or isn't compromise or flattening or impingement of the thecal sac. That's what they're talking about. Now, conservative treatment, it can vary, but in this office, this is one of the techniques that we would do with a patient laying flat, and we do what's called traction to the lumbar spine. Now, a lot of people ask me, what is the difference between what we do and decompression therapy, and what's the deal with this decompression therapy that's out there? It's similar. It's what the practitioner has determined that they want to use in their office and how they get adequate results. Traction is something that's been used in chiropractic profession for many years, And decompression is one of the newer types of therapy. I do know that it has not been, decompression specifically has not been backed by the chiropractic colleges yet, but that's, you see that often with techniques that are implemented but take a while before the colleges support. And that's based on how much research is done and how effective the treatment has been found to be within the evidence-based research that they find. So the types of traction that we do here is one, as I said, that has been used for many years, and we use the table, and it's a doctor's hand-on approach. We do not believe that patients respond as well if you set them up on some type of traction system and the doctor walks away. We just like more of a hands-on, and we can feel what's happening as we're doing the treatment. Now, another thing I'd like to talk about is spinal stenosis. You can have stenosis or a narrowing effect in the spine because of many different reasons. Some people say they come back or come into the office and say, oh, I was told I have spinal stenosis. Can you help? Well, spinal stenosis can be a central stenosis or a narrowing of the space. It can be an intervertebral foramen stenosis. How you can get a narrowing of the space is it can be a combination of soft tissue, hypertrophy or scarring of the soft tissue. So here's a ligamentum flavum, which is one of the ligaments in the disc. That can be hypertrophied, which narrows the space. You can have arthritis or buildup of the calcium on the inside wall of the canal. And you can also have the herniated disc that causes that impingement on the thecal sac. That also can produce a stenotic effect. If it's a stenosis because a person has arthritis or because they have a congenital or hereditary narrowing of the canal, there are surgical procedures that go in and scrape out or remove this calcification to open this up. A lot of what we do conservatively for somebody who has a stenotic situation is identify, first of all, what is causing the stenosis. Is it herniated disc? Is it inflammation? Is it the arthritis? Once you've identified what in fact is causing it, then you take the next steps. Okay, if it's inflammation, we deal with decreasing the inflammation. If it's the herniated disc, we deal with traction or removing that disc material that has escaped out. If it is a true osseous problem, well, then maybe a referral to an outside surgical source might be appropriate. This is another thing that we must talk about, which is the topic of epidural injections. We have patients that come in here all the time and have either had numerous epidural injections or are told that they might be helpful to them. Let's talk about what is actually happening. In the picture, you're seeing an epidural needle inserted into the epidural space. Well, what is that? The space where there's a little bit of space between the wall of the bone and in the canal. So that is the epidural above the dura space. So the needle is inserted, and then on B here, the anesthetic, whatever they determine the medicine should be, is injected into the fatty tissue and spaces surrounding the dura of the spinal cord, or in the epidural space. So it's injected in there. And over time, the anesthetic is broken down or absorbed into the tissues. If it's a steroid type of medicine, it causes or contributes to decreasing the inflammation because of the steroid, and that will help remove some of the stenotic effect of the inflammatory response. if it's arthritis that's contributing to it, the medication helps decrease the inflammation caused by the arthritic joint. When the joint's moved over the areas of arthritis, you get inflammation from that, and the steroid kind of minimizes that effect. Now in D here, the absorbed anesthetic travels through the liver and kidneys. Finally, it exits as waste in the urine. Now think about the process. We're injecting a steroid base medication, which we know long-term use of this can decrease your calcium in the blood. So long-term use of any kind of steroid can contribute to an osteoporotic condition because it's removing the calcium. And now you take these steroids, and as it's being absorbed into the bloodstream, the kidneys and the liver have to process it to remove this toxic medication out of the body. So that's another factor to be concerned with. It's creating some stress to your kidneys and liver to break down that material. 8 here, additional injections are necessary as the anesthetic breaks down or is removed. So why are we saying additional injections? Well, here's why. Because the treatment itself hasn't gotten rid of the source of the pain, whether it's arthritis that's developed, whether it's the herniation of the disc, whether it's ligament damage that causes this inflammation. The steroid itself is not a treatment that gets rid of the condition. It is a palliative or symptomatic method to try and control pain. So it's like taking an aspirin, where the condition doesn't go away, it just decreases your body's perception of the condition being there. Hopefully that'll clarify it. Is it a right choice for you? Well, that's something that you need to discuss with your doctor and weigh the pros and cons of that. Now let's talk about the nervous system. The nervous system controls and coordinates the function of all tissues, organs, and cells in the body. And this is done to promote healing and normal function. This is what the nervous system looks like. You have the skeletal system, which is the skull and the vertebral bones that encase the spinal cord and the peripheral nerves. And then you also have organs and systems of the body that need to be told what to do. So again, underneath the skeletal system, underneath the bone, you see the brain and spinal cord and all these branches of nerves that exit off at each level. Now you have to tell the skin what to do, or if you want to touch something and identify what you're touching, the nervous system has to identify that object and tell the brain what it is. And likewise, if you want to move your extremities, the brain has to tell the nerves going to the muscles to contract in order to move the muscles so it can actually function. So that's the peripheral nervous system, the sensory portion and the motor portion. So you put a hand on a hot stove, you feel the temperature and the heat, and it registers up through the spinal cord into the brain saying, aha, I've touched something hot. I probably shouldn't have. So the brain will send signals down through the motor division to contract the muscles and remove the hand from the hot stove. It's done a lot quicker than it took me to explain it to you, because it's devised for a protective mechanism, and if it didn't happen a lot quicker, we really wouldn't be doing its job in protecting you. So that's explaining how the peripheral nervous system works. So there are 3 branches essentially to the nervous system. We talked about the peripheral, which is the sensory division, which is responsible for pain, numbness, burning. And this is what usually brings the patient to the doctor if they have an issue with that, because the patient knows there's something wrong, I'm feeling something. The second is the motor division, which is the muscles. It's responsible for muscle function. So we've talked about that with the peripheral nervous system. The third is the autonomic division, and that's where the organs are innervated. So it's responsible for all the organs and systems in the body. Now, as a new patient here, you've undergone a spinal scan, and we've explained to you in the beginning what that entails. Well, you know that there's the 3 branches to the nervous system, and we need to identify what branches are affected by nerve stress, and if so, to what degree, and how long that stress has been there. And that's what the scan helps us identify. And we do follow-up scans to hopefully see improvement in the stress to the nervous system. And if you're not improving, well, then it gives the doctors here a better indication of, well, maybe we need to change the course of treatment. We talked about what the scan shows us. Red is severe nerve stress, blue intermediate, green is mild. And the length of the bar is important because that gives us a level of how chronic is this situation. So again, to recap, a scan tells us where the interference with the nervous system is. When there is interference with the nervous system, the body has a tough time healing itself. So this scan is a very valuable diagnostic tool. By knowing where the stresses to the nervous system are, your chiropractor can remove the stresses to allow for optimum body functioning. Now, facts. You are a self-healing and self-regulating organism. Fact, your nervous system is responsible for coordinating and controlling the functions of all tissues, organs, and cells in the body. And another fact is interference to the nervous system decreases the body's ability to heal itself. Doctors of chiropractic remove nerve interference. That is what we do. Now let's talk about what causes nerve stress. Nerve stress, the definition, we've been given a name. It's called subluxation, and that's the definition of nerve stress, particularly to the spine. But what causes it are 3 different types of stresses. Remember we talked about the stress in our life and how we had to adhere to the 6 facets of health? Well, these are stresses that we can't avoid in life. They come in the form of mechanical stress, which is slips, falls, accidents, and repetitive motions. The second is chemical stress, the environment where you, what you breathe, what you eat, what you consume, everything that can create a chemical response in your body. That's a stressor. The last one here is hormonal or emotional stress. This affects how we function and how we act on the outside as well as inside the body due to different hormone levels. Now, remember me talking about how the body can't differentiate between a good stress and a bad stress. The reason is that regardless, stress causes the body to release hormones. The hormones are epinephrine and norepinephrine levels. When they increase, our cortisol levels increase, which in turn will decrease our immune system. Whether it's a good stress or bad stress, the same process occurs. If a person is under chronic stress, that will occur consistently, and our body becomes depleted of our epinephrine and norepinephrine levels. Our adrenal glands, which are glands sitting on top of our kidneys, become very stressed out, and an adrenal gland produces our hormones. So you can see how chronic stress will really affect our body's ability to adapt to the stress and deal with a healthy immune function. The other thing to identify is women, we have estrogen progesterone levels that fluctuate throughout our life. Those hormones are responsible for creating a good um, joint mechanics. So when you have increased hormone levels, you have a weakness of the ligament structure. Now, that's designed for a good purpose. Women, we're responsible for um, carrying the baby and giving birth. And that process on our body, we need to have the ability for our body to expand and contract to house the baby. And in doing so, those hormones will allow these ligaments to stretch. Women are more susceptible to musculoskeletal injuries because of this hormone fluctuation, because you can't specifically identify one ligament for the body to relax and contract. It's going to affect all your ligaments. So to say, well, gee, I just want the ligaments associated with the birth and delivery of a baby to be affected. And frankly, we're not giving birth all the time. But still, the response or reaction to our hormones will continue to take place. The second thing is men have more fluctuations with testosterone levels. Testosterone kind of feeds into muscle strength and muscle health. So if you have a lowered testosterone level, it's going to affect how the muscles will react in men. So what did I just say here? I said the hormones affecting ligaments and hormones affecting muscles. In turn, muscles and ligaments make up the structure of a joint. So emotional stress will affect the mechanics of a joint. What are the three stresses? Mechanical stress. So it's kind of a cycle where all of these things affect the body. Now, subluxation occurs when a joint loses some of its ability to move freely, which can lead to biomechanical stresses and changes in the nervous system. A chiropractor will adjust the area of biomechanical stress to try and restore normal movement. Now, what is a pinched nerve and how can it affect my health? Take a closer look. A subluxation or pinched nerve might be very thin, a very small amount of change in the mechanics of that particular joint. However, that small amount can alter nerve function by 60% or more. And what happens if that nerve that's being impinged controls your heart, your liver, your stomach, or your kidneys? What happens if it's controlling your immune system and your hormone support? So a subluxation can have a wide range of effects, and depending on where it is in your body, how long it's been there, and other important factors will determine the outcome of your health. Remember those facts. Doctors of chiropractic remove nerve interference. Now let's look at the subluxation degeneration of the spine. Now this is important because a lot of times people come in and they say, I have arthritis. What does it mean? I've been told I've got degenerative arthritis of my spine. Well, let's talk about that. When you look at this chart, right here is a near normal. You've got that nice C-shaped curve, disc height well maintained. When you have a first injury to an area, now it can be a minor fender bender. In a parked car, somebody hits you doing 15 miles per hour. That's enough to put about 100 pounds of pressure on the joints of a cervical spine. In the event you're a person that sleeps on your stomach all the time and your head is turned one way or the other, it's putting that compressive force on the joints of the cervical spine. That can create long-term subluxations or irritations. Now look what has happened. The curve has changed. We don't have the normal C-shaped curve. It is straightened out. And in fact, right here, it's kind of going in the opposite direction. So that's an alignment change. The red irritation on the nerves is inflammation. 7 to 15 years beyond that first injury, we have some arthritic changes developing in the discs. We have irritation to the nerves and less mobility. 15 to 25 years, we've got thinning of the discs completely. We've got some fusion taking place, and that's depicted on this picture by, they look like little spurs or birds' beaks. Beyond 25 years, you start having atrophy of the nerves because it's not getting the juice that it needs, so to speak. At any point in time, chiropractic intervention can restore the normal motion and decrease the stress to the nervous system and remove the degenerative subluxation complex. I shouldn't say remove it, can halt it, slow it down, reverse it in some cases from above and below that area that's affected. Osteoarthritis, let's start by saying that it's two types of arthritis. You have osteoarthritis, which is a genetic component, and that's called primary osteoarthritis. And then there's a component called secondary osteoarthritis. That's what we're talking about here. Spinal degeneration in this manner is considered secondary osteoarthritic degeneration. And if you have it in one area, it does tend to spread above and below, and that's why it's so important to restore normal motion after a fall or injury to a particular area. And that's why, incidentally, the Arthritis Foundation advocates chiropractic care and exercise for that. This is what you would see on an x-ray. These are x-ray pictures of what we just went through, just so you can kind of get a look at what we see when we look at the bones. You're not going to see color where the discs were. You're not going to see the yellow where the spinal cord is and where it exits out. You're going to see the bone content on the picture. Then we're going to talk about the phases of care. The phases of chiropractic care are three. The first is acute relief care, and that is where we relieve or eliminate the pain. The second part of treatment is the rehabilitative phase of chiropractic treatment. And what are we doing in the rehabilitative phase? Well, we're adjusting the vertebral subluxation complex and restoring the integrity to the joint function, rehabilitate the connective tissue, which is the muscles, tendons, ligaments, and balancing the nerve impulses. We're restoring homeostasis, which is what we talked about earlier. We're increasing the flexibility and immune function and maximizing your health and quality of life. Now, in the beginning, in this rehabilitative phase, all those steps are taking place simultaneously. Now, in order to rehabilitate the connective tissue, you have to have the stress off the nervous system so the nerves are functioning properly to those areas. And in order to keep the pressure off the nerves, you have to have healthy connective tissue to maintain normal motion in the joint. So it's that cycle that needs to be broken in the initial stages of treatment, and that's why patients are required to have their treatments more frequently. That is what is necessary to overcome the subluxation complex. And remember, it's called a complex because so many things go into it. Remember the 6 facets of health we talked about? You may be required to make some changes to your lifestyle, your ergonomics, your hobbies, how you eat, how you sleep might need to be tweaked a little bit in this rehabilitative phase of treatment to help maintain the correction or integrity to the joint function. Once this is all achieved, we maintain health at the level of maximum improvement and allow your body to continue to adapt and heal itself. That's what we call maybe the supportive or wellness phase of chiropractic care.
How do we identify what the frequency might be for a particular patient who engages in that part of treatment? Well, that's determined based on the person's lifestyle, the person's stress levels, what stress they might be going through. People undergo different levels of stress at different points in their life. Um, if things are all going well and there are no major stresses, that person's uh, maintenance or wellness frequency might be very little. A person, however, who has lost a family member or going through divorce or a job change or a move, their stress levels are going to be higher than somebody else. So they might want to increase their frequency of chiropractic treatment in order to deal with that stress. Remember the equation. It's when your stress outweighs your body's ability to adapt to that stress. That's when you get sick, or when you have a problem with your nervous system. So as long as we keep that in focus when we talk about um, how frequent your treatment might be, and also, how compliant you are. If you're doing your exercises to support things, some people choose not to do that, and they would rather just come in and let the chiropractor take care of it. So it's very individualized. What is also individualized is subluxations that run in families. People have different familial hobbies and things that they do. Um, so if you look around, you see your children, you see your parents, and you see certain things that they do that they've shared with you that you might engage in, well, you might find that subluxations run in the family, just based on what you do. And so we highly recommend you have your children and other family members come in and have their spine checked. It's easier to deal with a small chiropractic problem, and it's quicker, and get patients to a preventative basis than it is to backtrack and have to heal and deal with somebody who's had many, many years of spinal degenerative changes and nerve stress. It takes a long time for that. And lastly, I want to again welcome you to our practice and thank you for choosing to become a chiropractic patient. And as in anything, if you have any further questions about this talk, please feel free to ask at your next appointment.